Hey everyone, I'm Michelle Coombs. I'm a physical therapist. In today's video, we're going to be talking about peroneal nerve entrapment. The peroneal nerve is also known as the common fibular nerve. This is actually a condition that I've had before, and I'm going to go over the exercise and the variation that I did. This helped me become symptom-free in about a week, but everyone is different, so it might take you a little longer, or if you're lucky, you might become symptom-free in less time than I did. Let's talk a little bit about the peroneal nerve. It is a branch off of our sciatic nerve, and it supplies motor and sensory innervation to our lower leg and foot. The common peroneal nerve, it branches off a little bit above the back of our knee, and it starts to wrap around to the front of the lower leg, right around the fibular head, where it splits off into the deep branch and the superficial branch. Now, the deep branch is going to innervate the muscles in the front of your lower leg, like the tibialis anterior, extensor digitorum longus, extensor hallucis longus, fibularis tertius, as well as some of your foot intrinsics. And the deep branch also gives sensation to the web space between our big toe and our second toe. The superficial branch, it's going to innervate the muscles on the side of our lower leg, so the peroneus longus and brevis, and it provides sensation to most of our lower leg, the front of the leg, the side of the leg, as well as the top of the foot, but not the web space. Some common causes of peroneal nerve entrapment include trauma. So if someone has a fracture near the fibular head or some sort of surgery or injury to that area, prolonged sitting in the cross-legged position, tight clothing, leggings, and it's rare, but it's also possible if somebody has a mass like a cyst in that area. Things that can increase the risk are underlying conditions such as diabetes as well as peripheral neuropathy. Now, the peroneal nerve, it can become entrapped anywhere along its path. It's most common in the knee area where the nerve wraps around the fibular head, but it can also occur closer to the ankle or even within the foot. A physical therapist might be able to determine where the entrapment occurs depending on your specific symptoms. So it's important to get an appropriate healthcare provider. Symptoms include numbness, tingling, and burning sensations in the skin areas that the nerves are responsible for. And later, if it continues to progress, they might experience muscle weakness in the lower leg muscles. Let's talk a little bit about red flags and differential diagnosis. We want to make sure that things that are more serious, such as compartment syndrome or cauda equina syndrome, etc., are ruled out. And we want to think about if the symptoms match a radicular pattern, if we think it's coming from the leg itself versus the low back. That's why it's so important to get an appropriate healthcare provider to evaluate your symptoms for you. Now let's go into the exercises. This is the first nerve mobilization. I can be sitting, like in this video here, or I can also be supine, which means lying on my back. So here I'm going to straighten my knee, and I'm going to invert my ankle as well as plantar flex. So that's pointing my toe downward. And here in this exercise, I'm just going to be doing this position with my ankle and then moving it back into neutral with my knee straight. Sometimes when you do this exercise, you might feel some of those symptoms of numbness or tingling, but it shouldn't be too severe. I'm going to do it about 10 to 15 times and just start with one set a day. Next day, make sure that your body tolerated it well before you move on to more sets. Here's the variation. I'm going to be sitting on a chair, straighten my knee, point my ankle downward and inward, and then I'm going to be keeping my ankle in that position while I bend and straighten my knee. You can do this about 10 to 15 times. Again, start with about one time a day. Make sure it's not flaring anything up, and then you can progress to more sets. So the first two exercises, they were mobilizing the nerve at the region of the ankle, whereas this one is going to mobilize the nerve at the level of the knee, so a little more proximally. Remember, if your nerve is already flared up, you don't want to further exacerbate the condition by doing something too much too soon. So make sure that you're doing these exercises gradually. Maybe start with once a day, see how that goes. And then if it's tolerated well, then you can try 2 to 3 times a day. Even after your symptoms resolve, it's important to continue your mobility and strength work throughout your lifetime. Many conditions, they can recur again, and what we're really looking for is lifelong health. I hope you found this video helpful. If you did, like and subscribe.